I welcome you all to the Healthy Heart, Healthy Life Pune session 15. I'm Dr. Neelkant Karandekar, MGDM, cardiologist from Pune. I do non-interventional procedures like stress test, echocardiography, and of course consultations at the three centers, Heart Clinic in TMV Colony, Alpha Diagnostics, Tilak Road, and Raghav Diagnostic Center, Jangli Maharaj Road. And I do interventional procedures like angiography, angioplasty, pacemakers, etc. at the Ruby Hall Clinic, Sahyadri Hospital, and Dinanath Pangeshkar Hospital. I have been conferred the honor of Honorary Professor Emeritus in Cardiology, and I'm also the first gold medalist of the Mumbai University at the DM Cardiology examination uh, held in Mumbai. A very well-known saying is a winning effort begins with preparation, good preparation. And what is the winning effort I'm going to talk about later is cardiopulmonary resuscitation. And if you want to do a good cardiopulmonary resuscitation, then you have to be prepared about certain things which we are going to talk about today. The vital techniques we all need to know to do good cardiopulmonary resuscitation is our topic of discussion today. First is measuring the radial pulse. Here is my left hand and I'm measuring my radial pulse over here. If this is your left hand and this is your right hand, you can place the three fingers just below the wrist on the inner surface of the wrist. And why three fingers? Because the radial pulse is a small artery, and one of the three fingers is definitely going to feel the pulsation of this radial artery. If there is a person sitting in front of you, you can use your right hand to measure the radial pulse of his or her right hand. And if the person is lying down unconscious, again, you can use your three fingers of your right hand to measure the radial pulse of either the left or the right hand of the unconscious person. Let us also see how to measure the carotid pulse. Carotid artery is the big artery, bigger than the radial artery, which travels on both sides of the neck. There are two carotid arteries, one on the left and one on the right. And you can use two fingers. First, you can feel the bone, prominent bone in front of the neck, and you just slip your fingers on the side and feel the carotid pulse, which will be usually immediately palpable. And this is how you feel the pulse, the carotid pulse on the side of the neck. If a person is unconscious, you should try to definitely see the carotid pulse if it is being felt because it is a bigger artery. Now, when you see either the radial or the carotid pulse, what is the first thing is the strength of the pulse that you want to check. 0 if the pulse is absent, 1 plus the pulse is weak, 2 plus the pulse is normal, and 3 plus the pulse is bounding. So now, if the person is weak, of course he has had a cardiac arrest. Heart has stopped. If the pulse is weak, the heart has gone weak, maybe due to a severe heart attack or something like that. The pulse is normal in a normal person. And third one is a bounding pulse in some conditions like anemia, etc. Second thing is the rate of the pulse, what you must note. And in men, the average pulse is between 70 to 76. Though we consider 60 to 100 as normal, average pulse is generally between 70 to 76. The healthier a person, the slower is the resting pulse rate. For example, in an athlete, it is 49 to 55. Bjorn Borg, who was a great tennis player, first time, 5 times Wimbledon champion, his pulse rate used to be very low, below 40. Then excellent good, above average, average, below average, and poor when the heart is weak, the pulse rate tends to be higher. And this is given for the various age groups 18 to 25 up to 65 plus. Recently, we have seen the Women's Day, and of course, we must know what is the normal rates, heart rates, and resting pulse rates for women. Again, let us look at the average. It is between 74 to 78, whatever the age, little up and down. And again, in an athlete, it will be lower. In a poor, heart, the pulse rate will be higher. Normally, even the average pulse rate in women is about 3-4 beats more than that of men. So you look at the strength of the pulse and the rate of the pulse. Next is to check a person's respiration. How to check that? Whether a person is breathing or not. Here, you can keep the ulnar side of your or the inner side of your palm, which is very sensitive, just near the person's nose. And you can try it with your own nose. If you keep the hand in front of your nose, you will feel the air going in and out. And this is how you can first method of how to check whether a person is breathing or not. Next is, as we know, that when a person is breathing, the abdomen goes up and down. It's called an abdominal breathing, which is a normal phenomenon. And if you keep your right hand on the abdomen or the stomach area of the person, you will feel the abdomen going up and down. And that is how you can again measure the respiration, and you can count for 60 seconds also. What is important is to know whether a person is breathing or not. Normal respiration is around 16 to 18 times in a minute. Then, last but not the least, is the pulse oximeter. When applied, this very, very elegant little cute instrument, when applied to the person's radial finger, will show you the oxygen saturation. Here it is shown as 97, and also most instruments will show the pulse rate. So this is that little instrument which I will show you little later. And let us talk about the oxygen saturation, what is normal. A normal healthy blood oxygen saturation level for most people is 95 to 100%. This percentage indicates the amount of oxygen your red blood cells are carrying, that your blood is carrying. Levels below 95 are considered low, and a level of 88% or lower usually requires immediate medical attention. Mostly the person has to be taken to a hospital, put on oxygen, etc. Whatever treatment is required has to be given. So thank you very much for seeing this video. And what we discussed today is the 4 vital parameters that you should be able to, as a health conscious person, measure in yourself or a person who you suspect is having some problem or has become unconscious. First is the radial pulse. Second is the carotid pulse, where you see the strength and the rate. Third is whether a person is breathing or not. And fourth is the use of the pulse oximeter. This is can you see this? This is a pulse oximeter. Here it is. And this is put on a person's, I'm putting it on my radial finger like this, and it will show the oxygen saturation and also your heart rate. And I would definitely recommend that you should have this instrument. And in case you're not feeling very well, or somebody else is not feeling well, or you think you see somebody becoming unconscious, this is a very, very useful instrument to use to note the pulse oxygen saturation, the blood oxygen saturation in that person. Thank you very much for attending this session. If you have subscribed to my channel, I'm very, very happy. If not, please do subscribe and send the information about my channel to your friends, relatives, and acquaintances, as I would like to spread this knowledge to the maximum number of people. Thank you, and thank you very much. Next time we are going to touch on the topic of cardiopulmonary resuscitation. And today we have discussed the prerequisites that are necessary, the skills that you must, simple things that you must, start practicing before you are able to help a person with cardiopulmonary resuscitation. Thank you very much.